So can I actually start with Yavuz? Yavuz, as you have been pioneering building hospital information systems, which are backed by AI-powered diagnostic tools, how do you view the evolving role of emerging technologies such as AI and genomics in shaping the future of care delivery? If you could please give us some examples of the work that you've done.
Good morning, everyone, and thank you for the great question, Dr. Hasham. My name is Yavuz Gencer. I'm the Deputy General Manager at AKGÜN Technology, which is an EMR company in Turkey, based in Turkey, established in 1986. And we've been working in the industry for almost 40 years now. So if you come back to the question, actually we are at an exciting turning point in healthcare. Emerging technologies like artificial intelligence, the Internet of Things, and genomics are not just improving care. They are fundamentally reshaping how it's delivered. And the shift is towards care, personalized, predictive, and proactive. Let's start with AI. AI transforming how we diagnose, make decisions, and manage operations. Imagine predictive models that flag patients at risk even before they appear. Or AI-assisted imaging that helps radiologists to detect any abnormalities faster and more accurately. AI also supports clinicians by automating routine documentation and even suggesting personalized treatment options. So doctors can spend more time with the patients rather than spending time on manual work. And then there is IoT, connected devices, wearables, and remote sensors are turning patients' homes into extension of hospitals. Chronic conditions can be monitored in real time, allowing clinicians to intervene earlier and prevent hospitalization. Smart hospitals use IoT to track equipment, streamline workflows, and enhance patient safety. And most importantly, patients themselves gain more control and engagement on their care. And we can't forget genomics, of course, the science of understanding our DNA. Genomics allows truly precision medicine. Clinicians can predict disease risks, tailor treatments to individual genetic profiles, and reduce adverse drug reactions. When combined with AI, genomic data accelerates therapy development and enables care plans that are unique as the patient. The real magic actually happens when these technologies work together. Imaging AI analyzing continuous IoT data while integrating genomic insights, delivering actionable, personalized guidance in real time. That's not science fiction, that's actually happening at the moment. So of course, we need to approach this responsibly. So protecting patient data, ensuring ethical use, and keeping clinicians in the loop. But when we get it right, we are moving from reactive hospital-centric system to a connected, proactive, and patient-centric ecosystem. One that improves actually the outcomes and enhances experiences. And at this point, I'd like to emphasize one point actually, the importance of early cancer detection. Unfortunately, globally, only a small percentage of cancer cases can be detected in early stages. But when they detect earlier, it can actually prolong the patient life expectancy, and also it saves time, reduces the complexity of the illness and duration, and the cost is actually associated with it. And the lung and breast cancers are among the most common cancer types all around the world. So, and unfortunately, they are the most deadly ones. So that's why, as AKGÜN Technology, we've been investing in AI technologies since 2012, and we actually produced cancer detection products that detect the cancer cells on lung images and mammography images. So they help the clinicians to actually detect the cancer cases in early stages. Well, thank you very much.
Thank you, Yavuz. I think a couple of things that you touched upon, which are part of this discussion, I hope will come out from our other panelists. Something you mentioned was smart hospitals, and we have amongst us Mr. Shahram, who has been leading hospital digital transformation. So Shahram, can I ask you to talk about what you think, or how would you define a truly smart hospital? Given the context, we heard a lot of our speakers this morning, and I'm sure through the course of this conference we'll probably get to hear smart hospital a lot. If for the benefit of our audience, if you could just elaborate, what do you mean by a smart hospital, and also touch upon digital transformation that you have been leading in Oman?
Hello everyone, thank you so much. This is a very good question to think about from time to time, because we need to revise the definition of a smart partners that will affect directly our projects, digital transformation projects. So if I want to give just one simple sentence that will stick into the audience's mind, I would define a smart hospital that is not only a connected system, but also a cognizant system. So let me elaborate more, go into the details. For me, a smart hospital is not just only a number of integrated point-of-care devices and third-party systems, but also how these integrated tools are interacting with each other, but intelligently. And let me highlight, and of course, having a connected system, having a fully digitally connected hospital is a fundamental principle of a data and digital maturity. And having an integrated the hospital is the first move through a digital transformation. But intelligence here that I'm talking about is not just technical. Let me say it's also organizational alignment and human empowerment, where a hospital learns from its own operation and also based on context-aware tools. This is the key point. By having a hospital that learns from its own operation based on context-aware tools, data can flow seamlessly, not only into an interoperable edges, but also into advanced technology layers like AI. We have heard a lot about AI here today in last sessions, and I found out that it's a concern, it's a hot topic, that what AI could do, is it going to replace physicians or not? So for me, AI is just an advanced technology layer, could receive data, understand data, act upon those data, but in a validated, monitored, confirmed a process, a manner. So in short, in summary, this is what I mean by saying the cognizant is not just a connected system, it's a cognizant system. So in short, in summary, a smart hospital in 2025 and beyond is a living, learning node within a health ecosystem that is not just only connected, but also agentic and responsive. In just one word, cognizant.
I think that was absolutely fabulous. I couldn't find a much better definition of smart healthcare and smart hospitals, so thank you very much for that. I think, Yavuz, you briefly mentioned early detection of cancers, and I think I'm very pleased to have Mr. Jesper. Mr. Jesper obviously is flown in from the Netherlands, and he is representing today as the commercial director at OncoInv. And OncoInv, as I understand, is a social enterprise which is under the Inspire to Live Foundation. I'm really interested in finding out, and I'm sure our audience is really, really keen to hear about the mission, vision, and values that you have been inspiring in your journey. So if you just mention a bit about your journey, and we'll then talk about early detection as well, but please.
Sure, thank you very much. Thanks everybody for being here. So yes, I'm with OncoInv. We are called a social enterprise. We have a very targeted solution for early cancer detection, but what does it mean that we are a social enterprise, right? We are majority owned by a patient advocacy foundation. So these are patient advocates, which means they have either have a lived experience themselves, they have been a caregiver for cancer patients, or they are physicians, or they are researchers, policymakers, and it's a global organization. So they have a very clear lens of what's happening in the more rich parts of the world, but they also have a very clear knowledge of what is needed in less rich parts of the world, because the cancer gap is actually the biggest there where development is the least. An interesting fact about cancer detection in Pakistan is that it's 70% of cancers get detected late here. And that is different from about 14 to 20%, depending what cancer you are in parts of the world where you have early detection programs running. And that is why we aim to bring it also to Pakistan, this solution we have on a not-for-profit basis in the public sector, and that's what we're pushing towards to.
Yes, well, thank you very much for that. I think anyone in the audience who's probably taking notes as I am, I think this is a huge number. 70%, you said, cancers get detected late in Pakistan, as opposed to about 15 to 20% in some of the more developed and smarter systems. I think this is an opportunity. I would really, really urge members of the audience to probably speak with Jesper after this talk and try and understand how we can try and collaborate in bringing some of these early detection solutions in Pakistan, where I think the need is absolutely very, very, very great. We heard from our colleagues who are actually working in digital health, telemedicine, how the challenges are actually being sort of countered. But I think nobody really pays attention to the opportunities. Talking about opportunities, we have the only lady on the panel, Ada. She's joining us from Adeo Global. Adeo Global, I believe, is driving strategic growth in the region. And when I say the region, it's GCC and Pakistan, of course, is included in that. Adeo, as a driver for change, and obviously you've been working at the forefront of bringing these innovative tech into the region. How do you see the scale and the opportunity for companies that are actually operating with Agentic AI and backed by Agentic AI coming into the region? So if you just talk a bit about that.
Yeah, so first of all, thank you for having me. It's a pleasure to be here today with everyone here, and thank you for the question. So to give you brief information about what we do, it's actually an accelerator that we work with health tech and med tech startups and scale-ups for helping them to strategically grow in the region. Why we say strategic? Because I think there was a misunderstanding of expansion to GCC from the companies. They were thinking that, we just integrated an AI solution to our system, we just established our office, so all the work will come to us. That's not the reality, because all the world is there. You know very well, we're also in Qatar, so it's a very, very competitive market. The important thing is to understand that how you can really solve something. What are the challenges of the market? Because not every market is the same. So when you mention about agentic AI, I want to actually link a little bit to the history. In history, we have always, just like industrial revolution actually, we have always developed and invented some products. First we focus on the functionality, then we made them more advanced and more functional, and we now care about customization, personalization, etc. And the third one was basically evolving completely something else, evolving something that is a necessity that we cannot think a life without that anymore. And today, AI is becoming one of them. So first we developed algorithms and machine learning because we had huge data lakes that we needed to make them meaningful so that we can use them. So for that, we first had algorithms and then machine learning, and then the second was generative AI. So when we talk about generative AI, it was basically we were writing some prompts, just like we do every day, right? ChatGPT, DeepSeek, whatever we're all using. So we were given some prompts to make those data useful, more understandable, and to understand what's going on. The third part is more proactive. So till now, we were reactive. Yes, we had the data. Yes, we had some sources, and we were trying to find some ways to use them more efficiently. Now, with agentic AI, we can become very proactive, because agentic AI is much more different than the other ones, because it takes actions, it takes initiatives, it decreases the workload of physicians, it relieves the health systems. It won't, everyone will say probably in all AI sessions at this conference, it won't replace physicians or humans, it will replace the ones who won't use them. So, but it's necessary and it's inevitable, and I think the GCC region and this region as well really needs it, because we have shortages in physicians, we have shortages in nurses, so we really need to find a way to integrate these solutions ethically, securely, because data security is very important in AI, because health data is very sensitive, and also more strategically.
Don't end there. You said strategically. Do you wanna build on that? How can, and I think if there are any startups, health tech startups in the audience, Eda is actually a person of interest for you, because as she mentioned, she's actually working with an accelerator. Also, just touch upon some of the work that you've done with that, so our audience can maybe benefit.
Sure. So in the past, I actually come from national healthcare systems background. I worked on Turkish national healthcare system, Qatar, and a small part of Saudi. I say small, but it's at the end of the day national as well.
Nothing is small in Saudi, so.
Yes, true, so true. So in UAE also, we developed some projects with Dubai and Abu Dhabi governments. UAE is not only Dubai, actually they do marvelous stuff in Abu Dhabi. There are a lot of research, a lot of investments initiatives in Abu Dhabi, and of course Saudi Arabia. So when I say strategic, what I mean is that, and I'm sure I have some HIS companies here, and I'm sure he can agree with me on that, because he focused on, I'm talking about Yavuz, he focused on AI in his speech. So HIS, in the meaning of we know, like digital transformation, I think it's going to land, it's not going to stand long. Why? Because now with AI, we can develop solutions so fast. Are they proven? No. But do they solve some problems? Yes. So to a very advanced country like UAE, the healthcare system, the digitalization is very advanced, and try to sell like a, I would say, basic HIS system, hospital information system, it's not going to work. It doesn't matter how much resources, how much investment, how much effort you put in. It's not going to work because the market doesn't need it. The market needs much more advanced system. But similarly, if you go and try to sell a quantum computing system in Africa, it's not going to work either because the infrastructure is not ready there. So that's what I mean by strategic.
So it's knowing your market, knowing the audience.
Exactly.
I hope the audience is capturing some of that. That's very, very useful. This is, ladies and gentlemen, this is actually a masterclass in how you go about scaling up a digital business. I think we heard from some of our colleagues earlier on saying there isn't enough support for startups, but even less support for scale-ups. So I think this is very, very useful. Shahram, can I actually come back to you? I'm really, really interested in finding out, at the Sultan Qaboos Comprehensive Cancer Care Center, we heard from one of our colleagues saying, I think Dr. Sahel, who's also my teacher, I've learned a lot from him over the years. I think patient centricity was what he mentioned. I'd like to understand, what are the particular digital technologies that you have actually, the innovations that you have implemented in your systems that have shown clear value in terms of patient experience and operational efficiency and improving clinical outcomes?
Okay. Before answering the question, let me just inform the audiences that tomorrow afternoon I'm going to have a workshop here, and I'm going to go into the details that what I said earlier, how we can go from a connected system to a cognizant system. I'm going to go into the details. I'm going to talk about the enablers, the challenges on the way, how to address, and how to go beyond a current definition of digital transformation and achieve a digital maturity, actually. So, and go back to your question. As a digital transformation consultant, the Sultan Qaboos Cancer Center project was one of my latest projects. It started since 5 years ago. And even from the day one, few months before receiving even the first patient, our strategy has focused on having a data-driven, patient-centric hospital. So to achieve such a strategy, we started to implement not only a fully digitally integrated HIS, but also to implement and build some layers. At that moment, it was not just AI, it was the other layers, but in last few months, we started also implement some AI-based solutions like AI assistants and so on. And by having these layers on top of the HIS, we've been able to not only show the data and observe the data to both administrative and clinicians, but also to have the patient involved in their own treatment experience, in their own treatment plan. And just one of the key innovations that we did, we embedded and integrated one of the oncology-based solution decision support systems into our HIS that lets the physicians and clinicians not only plan the treatment, but also let them have a visual observation on the whole chemo preparation, scheduling the chemo sessions for the patients, having patients in home if there was any side effect or not, manage their medication refills, and that was really improved the both patient treatment and also the patient safety. And the other solutions, like for us, it were like a normal solutions, like having patient portal, the mobility, and also integrated all the solutions like the Omnicell into the HIS to let the data flow and having data live in front of the physicians. But most importantly, we made, by implementing the solutions, we made patients having access to their own data, like the full access to their records, and also to request some changes in their own treatment, like scheduling appointments, refilling medications, having a virtual consultations if it was in immediate need, and they were far from the hospitals and were not able to travel quickly. And also for the physicians to plan the treatments more, not only quickly, but more wisely by having these live data. And also for the administrative in all levels, from top to the receptionist, to manage the patients through their own flow of the treatment. But most importantly, for the system itself to monitor the data, to validate the data, and to act upon the data. As I said, to recognize and detect some of those critical data that has to be followed by someone to take action, to send the alerts, to send the reminders, and also to involve some of the on-call physicians into the patient treatment to take care of the patient care.
Brilliant, thank you. I think for the audience, there is a workshop tomorrow. Do you know what time?
The workshop is starting from 2 p.m.
So tomorrow, 2 p.m. Please, if any of you are interested in knowing more about cognizant health systems and how they can actually help start solving some of the problems that we find in hospital operations, please join that workshop tomorrow. Thank you. I'm running. This is obviously a little unfair, but we are running short of time. So this is the last question. So I'll probably ask two of my panelists to contribute. Yavuz, you mentioned multi-cancer early detection. Jesper, that is obviously something which is a life's mission for you as well. What I'm really interested in knowing is what sort of AI-enabled tech can help us, detect cancers early, especially in the context of a low middle-income country like Pakistan. So if both of you could contribute on that, please.
Right. So yeah, this is exactly what we've been thinking about very deeply in designing the technology. So you might think you're in early detection, what is this guy doing on an AI panel? So we have an AI, which is machine learning based, which is able to analyze the results of a lab test, which is already existing. So that's not something new. But we add a layer of analysis on top to be better predictive of if there's cancer or not, so that you can actually apply it in an early detection setting. Now, originally the researchers were looking at DNA-based analyses. These are very expensive. The machines are not available widely in low-middle income countries. It has nothing to do with the AI. It has to do with the entire process, from blood sample to analysis in the lab, to the AI analysis that we do, and the final reporting back to the physician. So the whole process needs to fit in the low and middle income context. It needs to be affordable, it needs to be available, scalable by tapping into existing resources. That is key to the success of these programs. And even then, I would argue that it's still a tool that we sell. You can give me a chisel and I will not be Michelangelo, right? I will be more comparable to my 5-year-old son. It is that you need to apply the tool in the correct way. And how do you do that on an organized level? That's what I call a program. We've all been talking a lot about this on this panel. How do you apply it in the correct way? The right people, the right capacity building, and the right endpoints. So that is something that I think is very important. And it will change the acceptance of AI. There is a trust issue. In Poland, for example, we are stopping the use of the word AI in our marketing, in our communications, because people don't trust it. They think of ChatGPT, they know about the hallucinations of AI, and they were just not doing it. So now we call it a smart analysis. Yeah, sounds better perhaps, but it's very interesting to understand how the public perceives this topic. We are professionals, we understand it, but the public sees it differently. The trust will change. And I'll finish with a little story from Amsterdam. There's this video of people in 1999 being interviewed on the street, like, do you want a mobile phone? Do you need it? And people are like, no, why should I be connected all day? Why should people be able to reach me? I'd be fine without a mobile phone. And everybody was saying the same thing. Well, fast forward to today, things have changed, acceptance has changed, and our relation with technology as well. So that will happen going forward as well. Tomorrow I have a session in Hall 4 at 4 o'clock about a deep dive into our specific solution and what it can mean for Pakistan specifically. So I'd welcome you all there. Thank you.
Thank you, Jesper. Yavuz?
Okay. Thank you. So, first of all, tomorrow we will have the EMR workshop here as well. I think it's around 2:30ish tomorrow sometime. So I expect everyone to come actually, and we will talk in more detail about the EMR and how we do with the smaller or larger hospitals. As Adeo said, so actually the systems we provide are scalable, and so it can actually fit the needs to a very small hospital or to very large health complexes. So we can actually provide different solutions, tailor-made solutions for different clients and expectations. If we come back to the AI question, so we've been, as I mentioned, we've been investing in AI since 2012, and we actually, what we want to achieve is to reduce the costs, because you said the lower income countries, how do they use that technologies. So the main idea here is actually to reduce the costs for the cancer treatments. So the products we produced, or the solutions that we produced, they are mainly focused on early cancer detection. So they detect the cancer cells from the lung X-ray lung images, not tomography. So that is cheap in the first place. And it detects the cancer cells in early stages, which makes the the treatment easier and less costly, and it actually prolongs the life of the patients. So it's a win-win situation. And also the data is very important. While actually we're working on all those AI solutions, as an EMR company, actually we deal with a huge pool of data, and when you combine it with health information exchange, so the data actually, the pool of data actually gets even bigger. So it comes to the analyzing to that data and bringing out some meaningful and actually adaptable products from out of that data. Thank you.
Yes, thank you. I think, ladies and gentlemen, we just have to conclude here. I'd like to thank my esteemed panel. The audience, you've been a great audience. We spoke about industrial revolution, knowing your audience, managing the message. And I think the most important message is agentic AI, or AI in various forms, smarter analytics or solutions, is here to stay. So let's try and adapt. Let's try and understand it better. Let's try and learn, because this is a huge opportunity for us to develop and grow as we go. And let's try and use this technology for the best of our patients and even for our providers. Ladies and gentlemen, thank you very much. I wish you all a wonderful 2 days of the conference. Thank you very much.